Until you have a miscarriage yourself, I don't think you realize how common it actually is, because we don't talk about it in everyday life. It's too painful, people are uncomfortable talking about it, so we feel like we can't talk about it. But whether we like it or not, the reality is that miscarriage affects 1 in 4 pregnancies and up to 100,000 couples in Australia every year. And while the miscarriage itself is obviously devastating enough, oftentimes the way that we're treated within the medical system can add to the pain of this experience. And while this isn't a blanket statement saying that everyone who works with women who've had miscarriages is cold and harsh and isn't doing a good enough job, I think it does need to be recognized that we do need to address how we talk about miscarriage, how we treat women who are experiencing an early pregnancy loss. And that's why I think these new national guidelines that aim to guide the treatment of miscarriage, of early pregnancy loss, of recurrent miscarriage, and also ectopic pregnancy, I think these guidelines are a really good step in the right direction. And you only have to go to the comment section of the ABC News post on Instagram describing these guidelines to see how varied the experiences are of women around Australia who've gone through these types of losses and who have felt that their treatment was inadequate or worse, really harmful because of the way that they were treated. I want to read a few of those comments to you. I had a miscarriage at 19 weeks. I was placed in a ward with new mothers and told to stop crying because I was disturbing them. I was told by the ER doctor to go home and wait until the contents have been expelled. The contents were my unborn twin babies. Can we also not put women who experience a loss in the same ward as women birthing healthy babies? You have not known torment like the sound of newborns crying and making your breasts produce milk you can't use for your own baby who lived for only 10 minutes. This one gets me because I have birthed my baby who would not survive whilst listening to the sounds of newborn babies. A good start would be to not have to wait in a waiting room full of expectant mothers while you wait to lose your baby. A lot of the times here in Australia, when you go to the early pregnancy clinic, if you're worried that you are experiencing an early loss, it's right next to maternity or it is within maternity. So you're going into a waiting room with other women who are having their regular checkups for their pregnancy, their midwife visits, those sorts of things, sitting there. Yeah, it's just a lot. I just wish there was a space where it could be more private and less confronting that you're sitting with all these other women in their joy whilst also going through the worst experience of your life. This one, immense gratitude for those who have fought for this awareness and funding. Having had 7 miscarriages and no live births, I've experienced several traumatic experiences through the hospital system. Treatment which was inhumane, dismissive, but most of all uneducated. One time, after waiting in emergency, bleeding and distressed for 3 hours, I was asked to go home, bleed out, wait and catch the embryo passing. Then divide the sac and tissue into 2 canisters and drive to another regional city to drop them off at pathology for testing. No care, no therapy, no thought. The mental and emotional trauma from repeated miscarriages and failure to become a mother doesn't pass. I am appreciative of this reform and awareness is on its way. This one, the impact and the experience is underestimated. I read it was like having a heavy period. It was a loss. It was a lot worse and I ended up being hospitalized. This one makes me mad. Like, please stop telling us it will be like a heavy period when it's like a birth. And yes, I get that saying that might make a woman feel distressed and uncomfortable, but maybe we need a little bit of that so that then you can provide the support around, well, how do you look after yourself through a birth at home? Because that's actually what you're telling us to do, to go home and birth this baby who has not survived at home. And that's really confronting, but I think we need to prepare women for that and use language for that that is appropriate to what they're about to experience, or else you are setting them up for a traumatic experience. Finally, I was literally told to just keep trying because even though I'd had 3 miscarriages, only 2 of them were consecutive because I'd had a baby in between and therefore it didn't warrant further investigation. I accessed support privately and a simple blood test showed I was undiagnosed celiac disease. I went gluten-free and am now holding my 4-month-old bub. I remember feeling so frustrated after I think I'd had 2 losses, and I was obviously devastated, and I was looking for answers and talking to my doctor. And because at the time you had to have had 3 losses for it to be described as recurrent and for them to look into the condition of recurrent losses, my 2 weren't enough. Like, imagine being told 2 deaths, 2 babies that you desperately wanted. That wasn't enough. You hadn't had enough yet for us to take this seriously. It's so disheartening and infuriating because it feels like they're not taking it seriously. And this one. We were camping 2 hours from a hospital at the time and was told to go home and only come back if I needed pain relief. I told her I came in because I needed pain relief and they'd only given me Panadol. She told me I obviously wasn't a mum because if I had thought this hurt, just wait until real labour starts. Truth be told, I've gone on to have 2 unmedicated births and neither hurt as much as my miscarriages. Oh, this one kills me because I know that pain. Like, it's the pain of birthing a live baby is so different to birthing a baby who you know isn't going to survive or has already passed, because you don't have that euphoria that regular birth gives you that helps to deal with the pain, those good hormones that flood the body, the oxytocin that help to reduce pain. So yes, it absolutely can be more painful because your body doesn't have those things that naturally guard us from some of the pain of birth. So all of that to say, these guidelines are very needed and very wanted. And ultimately their aim is to provide that empathetic, consistent care across the country and to set out guidelines for the people who are going to interact with us when we have these losses, to make sure that we're feeling supported and to make sure that we have the information that we need and to make sure that the system recognizes how big this experience is. And whilst yes, for many of us doesn't involve medical treatment, it can happen at home, it still needs to be dealt with in a really sensitive and caring way. So one of the main changes is that definition of recurrent miscarriage. So now more accurately, they will investigate and look into what might be going on for you if you've had 2 miscarriages. They don't have to be recurrent, so they don't have to be back to back. You may have had a healthy pregnancy in between. So previously it was 3 miscarriages in a row. Now, as soon as you've had 2 miscarriages in whatever order, they will look into that for you. Of course, you could have always gone privately and done this yourself, but then it would cost a lot out of pocket. That's what I chose to do, but I also recognize not everyone has the privilege of being able to privately pay for the blood tests and for the doctor's visits and all those sorts of things. So this is a welcome change that women can now access this healthcare after 2 losses. The guidelines also acknowledge the physical and emotional toll of miscarriage and are working to change how women are provided support following their miscarriage, so they have access to those supports and don't feel like they're being unreasonable because they feel like they need them. I think in the past, a lot of the time we've just been told to go home and it will happen naturally and to come back if there are any complications. And we sort of feel like, hang on, what? I have to do this thing on my own and I'm only allowed to come back if I'm in extreme pain or like the bleeding doesn't stop. But what about the fact that my heart is broken and I don't know how to deal with this, and then how do I get healthy again after this? So I think this is a really good change in really focusing on these women at this time are at their most vulnerable and they need emotional support first and foremost. And that emotional support allows them to feel like, yes, this is a real thing you're going through and it is really big and it is really hard. And if you need more support, this is where you can get it from, and really linking women with those services from the start and not just letting them feel like they need to go home and deal with it on their own. The guidelines also recognise the importance of healthcare providers using the language that women are using, not referring to their baby as the contents of their pregnancy, and using the language that women are using. And honestly, we're using baby because we're having a baby. We didn't want to have a pregnancy. Nobody wants a pregnancy. We want the baby at the end of it. So the guidelines are really asking clinicians to use the language that women are using when they come in so that it can be more empathetic. And I think that helps for the healthcare providers as well, because when you're just thinking this woman is having a miscarriage, that doesn't connect you to the emotions of the experience and what this woman might be going through. So I think it's really important to use the right language, because the language helps us to feel supported. So this is a really welcome change. Above everything else, I think these guidelines are so important because it recognizes how big miscarriage is. It recognizes that we need spaces to talk about it. It recognizes that in the healthcare system, it needs to be treated compassionately and thoughtfully and not in a way that creates further trauma. And I think having these set guidelines is the first step. It obviously is not going to create change tomorrow. It doesn't mean that every person interacting with the medical system is going to get this level of care, because that's going to be up to the individuals working in these spaces. But I hope that it also helps women who have had negative experience, myself included, help to feel a little bit validated, that someone's now recognizing that wasn't good enough. How you were treated wasn't good enough. And this is how we want to change going forward. If you want to read the guidelines for yourself, I'll leave them linked in the description box below. And if you have gone through an experience where you need help unpacking the trauma of that experience, or maybe you're going through a miscarriage now, please reach out for support, whether that's a counselor in your local area or to me to have a one-to-one virtual session. I think you need to call in support and not feel like you have to go it alone when you've been through such a big loss. If you're looking for some other free resources, I'll also leave those linked below. Look after yourself, and thank you for being here.